Hello, my name is Marta Escobedo, and today I'm going to be presenting on individual interventions and group interventions and the difference. So usually your typical session is an individual session for occupational therapy. An individual session is one patient and one therapist. And your group will always be two or more and one therapist. Individual sessions can be 35, 45 to an hour long. It's always based on the client's needs. And group sessions are based more on the activity that you're doing, the task that you're trying to complete, and trying to find a good timely manner that you're going to be able to complete it in. They're usually, though, 45 minutes. So individual can be 30 minutes, 45, or an hour. And groups are usually 45 minutes long. So I'll put here most of the time. So individual therapy sessions always focus on individualized activities towards the patient's goals. So the benefits of this is you can have the client more engaged, less distractions. You can focus it more on the individual that you're working with. You can have working on more than one thing with the patient at the same time because all of your focus will be on this individual. So like for children, it can be beneficial because there will be decreased distractions for them, so you can get them to engage more with you. And you can see more of how they do independently versus in a group setting. For adults, it can be beneficial because, again, you can work on increasing their skills and seeing where they're at. And then it can also help build that rapport with them. And they can work more on towards what they want to work on. A lot of times with adults, they're based on what their wants and needs are. And they verbalize these wants and needs to us. So then we can focus more on what they want to work on. So we can focus more on safety with the individual as well. When you're in a group setting, you are trying to focus on all the aspects of it, but it is a bit different because you have more than one patient to look for and attend to. So it is a bit different. But we will go to group sessions now. So some of the benefits, like I said, are decreased distractions, you can have increased interactions with them. Okay. Okay. For group interventions, like I said, they're usually 45 minutes long to an hour long, depending on what you're working on. The focus for this is to find a task that is appropriate for all the group members that you want to engage in, and make sure that this task that you choose, activity that you choose, will benefit each patient, and you're able to document that and give reasoning to why it benefits them. In a group setting, they're working on the same activity, but maybe they're targeting different goals. So you can be working on some type of task, but it has different components to it. And one of the components may be beneficial to one patient and the other one will be beneficial to the next. So they don't have to be working on the same goals. They don't have to have the same plan of care at the end of the day because there could be different components that you're trying to work on with those patients. You just have to give your reasoning to and explain why. So this will also help work on increasing their social skills within each other. and increase their problem solving. It can benefit them in different ways. So for children, a lot of times that we do group therapy with children is to work on the social skills, work on sharing, work on engaging them in different play with other students, other children their age, so they can increase their skills. Working on those communication skills, and then it can work on problem solving when completing a certain task that we want them to complete. They can also use their peer and see their peer to guide them in doing something. So if they see their peer completing a certain activity in the group, they can follow that peer. So we can use that like a leadership roles kind of. They can build friendships as well. So for adults as well, an example is in a skilled nursing facility. If you do a group training or something, a group for something, it could be a new patient that was just admitted. They don't know nobody. They want to engage in this group therapy session, and then they can meet new people, learn to communicate with these people, increase their social skills within their new environment. So that's one of the benefits to it. So some of the things that you want to do when planning a group session is focusing on all the individuals and all the goals. So again, you have to break down the activity, break down your individuals that are going to be in your group, and focus really on how is this group activity going to work with each individual. You have to give your clinical reason as to why you think a group session was better than an individual session, and just making sure that you are benefiting your patient overall. That's the most important thing. So you need to see and explain, like I said, give clinical reasoning. You always have to take into consideration any impairments that these individuals can have, and that will impede them from participating in an activity or just being ready for any obstacle course that might come in the way, and you're going to have to be able to handle that and make sure this activity works for your patient. Another way that a group intervention can be beneficial is if you have a group for a certain diagnosis and you have people that are in different stages of recovery. This person that is in stage 1 recovery can see what it will be like in a stage 2 recovery, or so on. It's just an example. And they can kind of see what they're working towards, and also learn those skills. So the way we document is a little bit different. An individual note, obviously you would always address everything you're going to do. For an individual note, you're going to do your regular type of note, explain what you worked on. For a group session, it's the same thing. You document the same, but you're going to include why was this group more beneficial than an individual activity? Why did you choose this activity for your group? What type of group it was, what was your overall goal for the group, and how long the group was. Okay, so now I'm gonna kind of talk about the differences. I'm gonna give an example of an intervention and how it would look in a group setting versus an individual setting, and just a little bit of the difference of how it would be. So we could talk about, let's say, a fall prevention group. So a fall prevention group, in a group setting, it might look like a presentation. So like a slideshow, you'll have a slideshow, you'll go over your slideshow, you'll have pictures to show how to complete these transfers, and decreasing that fall prevention, how you can complete mobility, functional mobility with decreasing that fall prevention. And this is what it will kind of look like. You can give examples, you can kind of demonstrate with the patient or not. It really just depends on the group that you decide to choose. So you can do demonstrations. So for an individual, most likely it will look like a handout that you will provide to them. Handout. You will work one-on-one with either the patient or caregiver to work on how to decrease the fall preventions, how to decrease those falls. You can go on and fully practice because you can focus on safety, all the safety components, versus in a group. You can target that in a group, but let's say you have a group of 5 and you only have 1 hour session. What you really want to focus on is educating them on the main concerns. So the fall prevention is the main thing, and then you break it down. You might not do demonstrations and practice with each client, but you know that they're understanding the basics, and when you do individual treatments, they have this down. When you do individual, you have more time maybe, and you can do handouts. You have more one-on-one time with them, so you can do the handouts, you can do the teaching, and then you can practice it hands-on. So more hands-on because you have more time, and like I said, it's more individualized to that one-on-one. So there's just so many interventions that you can do. Like for adults, we can do safety training, energy conservation programs, adaptive equipment programs, social skills programs, ADL programs. For the kids, the same thing. You can do ADL, social skills, fine motor, sensory, gross motor. Kids love to play with other kids, and kids learn by playing with other kids. So this is a very good thing that we can do, outpatient, inpatient, school setting, anywhere that you can gather 2 or more kids to make that group will be very good. That is what I have on group interventions and individual interventions, and a little bit of the difference, how you can kind of break down the intervention and see the little bit of a difference, the documentation aspect of it, what it is. And that's pretty much what I have on individual and group interventions. Thank you for watching.